Hello, this is the Winnebago County Health Department's TV show where we talk about public health and relate it to your health. I'm Alana Erickson, and today we have some guests doing some truly collaborative work around mental health in the region. I'll let them go ahead and introduce themselves and their roles.
My name is Beth Clay. I'm the Executive Director of the Northeast Wisconsin Mental Health Connection.
Okay.
And my name is Rachel Podosky. I am the Project Evaluator of Healthy Teen Minds.
All right, so Beth, you're here today to talk a little bit about the program, where it started. Just give us a little brief introduction.
Sure. So the connection was created in 2011 after we had a community health action team plunge around mental health. And the community really decided that they wanted to handle mental health in our community with a wide range of stakeholders, not just the traditional thinkers in healthcare. And so we are a membership organization, and we include school districts and health departments and health systems and everybody from the community to work on kind of the system level issues within mental health.
Mm-hmm.
We were really well positioned for a grant opportunity. It's an 8-year grant to look at the behavioral health of our region of Outagamie, Winnebago, and Calumet counties. And we are doing that together, looking at the rate of teen depression in the valley.
Okay, so you got this grant last year, correct?
That's right. So we're in 1 year to the 8-year grant. Year one was a planning year, which meant that gave us the opportunity to really dive into our local data, to look at the literature and understand what the driving factors are behind teen depression, not just kind of our mental models and what we think is going on, but to really understand the problem so that we could figure out what the leverage points were. So we know kind of what data points do we need to move to really see a difference at the population health level for the rate of depression or risk for depression in 12 to 18-year-olds.
That seems really important for an 8-year grant to take that time to really plan. So what did you find in this first year of data diving?
That's a great question. So let me say one more thing about the kind of the format. So now we're in year 2, and we have 5 years of implementation. So the plan that we came up with, we now have 5 years to roll it out, and then it also includes 2 years of sustainability planning at the end. So we want this to not just come here, but to stay here. And so we learned a lot about what drives depression in our kids. Some of those things include their sense of connectedness at school and whether they feel like they have peers and a trusted adult at school. Their sleep impacts their mental health, especially the rate of depression. Whether they have access to services and proper screening at their age to find out if what they're experiencing is normal or not normal. And so we have lots of different strategy points to try to move those things.
All right. And Rachel, you were key in looking at that as the evaluator, correct?
Right, that's exactly right. When we went into the planning year, we didn't know what our project would focus on. So it took a good 6 months of engaging with local stakeholders until we settled on youth depression. And once we had kind of set our sights on that age group and that topic, we looked to the Youth Risk Behavior Survey, or the YRBS, and that showed us how we're doing in the region. And what we saw was this slow but steady increase in those who are reporting sadness and hopelessness for 2 weeks or more. It went from about 22% to 26% in a total of 6 years, which might sound small, but is very significant from a statistical perspective and represents about almost 1,500 kids every year.
That's quite astonishing. So who are you looking at? What are the age ranges?
So the goal of the project is to reduce reported rates of depression in adolescents in grades 7 through 12 or ages 12 to 18. So that's really our target population. But when we were looking at strategies and many of the factors that Beth mentioned, we wanted to incorporate strategies for that age group, but also more upstream. So for that age group, we are implementing an evidence-based program in high schools called Sources of Strength. So this year that's happening in Oshkosh, Neenah, and Appleton, and then will be scaling it up to more districts each year. But to move more upstream, we are working with elementary schools and the Department of Public Instruction. They're really championing some work around social learning and emotional regulation, which will give these kids resilience and coping skills for years to come.
Sounds good. So we were kind of talking earlier about what's really been a good success and where you're getting the greatest support, and you talked about the willingness of school districts.
Yeah, the schools were really important adopters for us, and fortunately those 3 districts were our early adopters. They understood what we were doing. They felt like it was a good fit for how they wanted to roll out the mental health care of their students. But we'll be scaling it over the 5 years to hopefully all 24 school districts in our region. We also want sources of strength to reach the rest of our community, and so we chose to train a trainer within Boys and Girls Club because before and after care is a part of a child's school day, but that also brings more trusted adults into the community that are using that language and sharing the sources of strength as a way to cope and manage with life.
Can you explain the trainer just a little bit more?
Sure. So that's one of the really key parts of us leveraging the dollars that are coming to us. So over the 8 years, we have $1.2 million coming into the community to help us set these things up. But we were able to pay more than half for each of the initial school districts, train a trainer, and that will allow us by year 2 and 3 for the cost to go down per school from $5,000 to $750. So we feel great about our ability to leverage this and make it possible for all of our tiny districts as well.
That's great.
And having a local trainer will really help in those 2 years of sustainability in ensuring that it's embedded in the community. So it's kind of a best practice for sustainability.
Great. So it sounds like the partnerships and the willingness of schools has really been a strength for you guys. What's been a barrier?
Well, I would say one barrier is, or it might be a perceived barrier because I don't feel this way, but the fact that we have 24 school districts in our region is really significant, especially when you compare us to some of the other regions of the state that are doing this that might just cover one county or maybe 2. Mm-hmm. This is really a significant number for us, but we have the plan to roll it out over the 5 years and feel confident in that.
Great. So what can the general public do then to support these efforts and help out the connection?
Well, I think there's certainly a lot of public awareness around this subject and growing awareness through the Life Study and the Kids in Crisis series. We know that our rates of suicide attempting are really high in the region, and that goes hand in hand with depression. So first, I would say just being aware of it, and then talking about it. If you know someone in your life who is struggling with mental health challenges, understanding that it's a normal part of life, and just being able to have that conversation.
Absolutely.
Anything to add to that?
I would just say that one of our other initiatives in connecting people to mental health services is our website, myconnectionnew.org, which is a place where people can really navigate services and search for and find appropriate services for the age group of the person that needs them, the particular issue they have, whether their insurance is covering it, and all of that kind of stuff. And so we hope that people will use that resource to navigate services and also to gather mental health information and substance abuse information.
Great. And we did put together a short little clip to show the audience, kind of introduce them to that website. But before we cut to that, I just want to thank you guys for both coming on. Thank you for the wonderful work you're doing. And I'm sure that if anyone wants to know more information about how they can support your efforts or get involved, they should just contact you guys through the website, or?
Absolutely, that's the best way to do it. And we just want to say thank you to the Winnebago County Health Department, who's serving as the fiscal agent for this project. We're very grateful.
Great, it's important work.
And you can also find us on Facebook. So.
Ooh, good to know. All right, so with that, we're going to introduce you to the website. Have a look.
Before we take a 2-minute tour of myconnectionnew.org, the New Mental Health Connection would like to acknowledge our partners at United Way 211 for generously sharing their directory of mental health and AODA resources. In total, this website has compiled a directory of over 300 providers across the Tri-County area. And when you visit the site, this is what you will see on the homepage. You will notice the Need Help Now button, which will pull up a list of local and national crisis lines. And if you are accessing the site from a mobile phone, those telephone numbers are clickable. This red button appears in the same place on every web page as you navigate around the site. Another useful feature is the option to change the display language or to view the site in large print. By integrating all text with Google Translate, there are over 100 language options, as well as professional translations for 14 of the most common languages. On the right-hand side, the blue box that says Check Up from the Neck Up is a link to an anonymous screening tool developed by Screening for Mental Health, Inc. It is totally free and guarantees your privacy and security. You can answer questions for yourself or on behalf of a loved one. Two of the most popular links are the library, which is similar to WebMD but specific to mental health and AODA-related diagnoses, treatments, and prescription options. And last but not least, the Services tab. Here you can search by category, agency name, or keyword. Advanced search allows you to enter your zip code and language preferences. This search functionality also appears on the homepage. There are many more features on the site, and we want to encourage folks to visit myconnectionnew.org and explore all that it has to offer.
Welcome back. You're watching the Winnebago County Health Department's TV show, where we talk about public health and relate it to your health. That was a short clip introducing you to the My Connection New website. We also wanted to mention that the Connection has a lot of promotional materials available, postcards, posters, and even table tents that are available that you could put out at your restaurant or other places where the public might see them. So if you're interested, please contact them. On to our next guest today. We have a bunch of different people from the community, both participants and workers from the health department. So we're going to talk a little bit about classes for promoting healthy aging, and I'll let them introduce themselves and their role.
Hi, my name is Joanne Murphy-Spice, and I coordinate the classes for the Healthy Aging program for Winnebago County.
And I'm Jamie Roth. I'm a community outreach coordinator for Rehab Erices.
And I'm Peggy Marler. I'm a participant in one of the classes.
All right. Well, thank you guys for joining us today. So first of all, let's start off with what is an evidence-based course? We hear that term, but it sounds a little tough. What does it mean?
Absolutely. It's a fancy name, just meaning that the classes have been researched, they've been studied, and they have been proven to show success in the community.
Good. So what types, or who organizes these classes here in Winnebago?
Well, it starts actually at the state level. It starts at the national level, actually. The research usually comes from universities. So the different classes we have come from a variety of universities like Stanford, Tufts, different universities like that. And then the Wisconsin Institute of Healthy Aging, they're like a clearinghouse. They take care of getting that to all the different counties in the state. They're the technical support for us. They do the training. And so it's a real good marriage, so to speak, and they get the new classes to us.
And you say us. Who's us, the final level, bringing it in?
Us is, for us, and for the classes in Winnebago County, it's the Health Department and specifically the Winnebago County Wellness Coalition, which Jamie knows more about than I do because she's been involved with it longer than me.
All right, and we'll get to that. So what types of classes are out there? What can people sign up for or take?
Yeah, so there's a lot of different options. A few of them would be healthy living with diabetes, living well with chronic conditions, and then powerful tools for caregivers. And then
the two we've got this fall are the Strong Bones class, which is geared towards men and women over the age of 60. It's a strength training class, really good for people with arthritis, osteoporosis, things like that. And those are in every city in Winnebago County. And then we've got Stepping On, which is a falls prevention class. And that one is being held in Menasha and in Oshkosh this fall. And Peggy Mahler is from a former Stepping On class.
Good. So we'll get to hear the dirt straight from the source, right?
Exactly.
I'm glad to hear. It sounds like there's a class for everybody. Who are these classes geared for? I mean,
it kind of depends on the class. For like healthy living with diabetes, you know, you can be 25 and have diabetes. So when people hear the word aging, they think older adults, and that's not necessarily what it means. From birth on, you're aging. And so those classes would be younger. The Stepping On Falls Prevention class, we tend to see people who are a little bit older because the risk of falls does increase. We see a lot of daughters and sons bringing parents because everybody's headed there, and then you know what your parents are going through. So it kind of depends on the class.
Good. Well, since Peggy's here, we can hear how it went for you. What class did you take?
I took the Stepping On class.
And was that this year?
Yes, it was the last session that they did.
Okay. And so what interested you to sign up? What caught your eye?
Well, actually, I was approaching my 70th birthday, and so I thought that falling and breaking a hip would be really adverse to my goal of being self-sufficient as long as possible. So when I saw, the sign up at Marion Manor where I live, I went, ooh, and I signed up.
Great. Well, what was fun for you? What did you like about the class?
Well, probably my favorite part was the fact that it was a really well-organized environment. It was a comfortable environment. It was well-equipped. The facilitators were encouraging, and it wasn't, like one where we were taught all the things we were doing wrong or whatever. We got to practice what we were learning. We got really great handouts. It made moving from learning information for someone my age, which takes a little more issue, to actually putting it into your life and using it on a daily basis.
Great. Did you know people that you took the class with, or, did you just show up and hope for the best?
Well, actually, Barbara, who is one of the nurses at Marion Manor and also a facilitator for the class, came and asked me that since I still drive, would I mind driving some ladies. So I pulled up in front of Marion Manor, didn't know the ladies at all, so I'm like hoping that they'll figure out who I am and get in my car. And so I got to know those ladies really well, and that was really fun. And one night I actually couldn't get into the building, and I was glad I dialed up one of those. Could you let me in, please? It was great, and everybody in the class was fun. By the end of the class, we all knew each other.
Sounds great. So what are the biggest changes that it made to your life?
I really thought I knew a lot because I had done home care for elderly people, but I was surprised at how much I didn't know. And I would say that the most important thing was learning to be aware of my apartment. Things like it's better not to have things used all the time on the top shelf, so I rearranged my apartment. How I use my feet to walk. I actually did fall a few years ago because I tripped over tar on a sidewalk, and if I had been thinking ahead of what was coming up and walking heel to toe the way we're taught, I would not have had that fall.
Great. Well, thank you for coming and sharing that insight. Even hearing what you have to say is making things come to my head that I wouldn't normally think of. So how long have these classes been around?
So some of the classes have been around for as long as 7 years now. They actually, originally Stepping On was the first class in Wisconsin, and actually started in Australia. So they brought it to the States and have really expanded it. Some of the newer classes have only been around for a couple years. For Winnebago County, in the last 2 years, we've really done a lot of focus of bringing the classes and starting more here.
And so they've been going on for a while. How do people know when they're going on, where they're going on?
That's a good question. We have, go to our website, first of all, the county's website, the health department's website, and it'll be right on the first page. and it will also be on the events calendar. The other thing you can do is call the county health department. We'll answer any questions you have. There are flyers, lots of places. We have brochures, we have posters. If anybody in the community wants some to put up in their store or whatever, just give us a call and we will get them to you. A lot of physical therapists use the flyers for stepping on because they see a lot of people who are recovering from a fall. And we all know as you age how scary a fall is and how it can really change things for you. And the other beauty of stepping on is it makes you realize that while you have the fall as an accident, probably things could have happened before that could have prevented it, and you learn those tools. And there's a physical therapist, a pharmacist, a police officer to navigate in the community. There are many guest experts that also talk to you about the different things that affect your risk of falling as you age.
Okay. You said earlier that they're in every county or every community in the Winnebago County. So we've got Amaro, Winneconne, Neenah, Menasha, and
Oshkosh.
Okay.
For strong bones, the strength training class, that is in every single city. My goal, and that's kind of my role, and why I was brought on, is to get those classes like stepping on, healthy living with diabetes, living well with chronic conditions, powerful tools for people who are caregiving a family member. Get those in every one of the cities and on a regular basis, like every fall at this time, every spring at this time, so that then I can do the other part of what I want to accomplish, which is to collaborate with healthcare providers in those communities and other community members and organizations so that we get constant referrals, so that we have the goal of people that have access to these programs all of the time near them. We'll even help with transportation if we can and things like that. So we're really working to towards our goal of having quality as we age also.
Good. And how affordable are these classes? I mean, is there a price tag on them?
Well,
Peggy said very. I
Very.
just wanted to repeat that.
It was
that was
$15 to take the stepping on class.
Okay, and that's about the average range. And how many classes are in it?
7 weeks.
7 weeks.
So 7
at
classes.
2 hours. The
Nice.
strong bones class, we were laughing about it because it's a strength training class. You use weights, and we were figuring it out because it meets twice a week for an hour. And for 12 weeks, it's like 61 cents a class, which I don't know any place you can have a class for 61 cents.
Sounds like a good deal.
Right.
And you can go hang out with your friends, right?
Right.
Your new friends that you're making. Well, thank you all for joining. Learned a lot today. Again, I just wanted to reiterate, your role is to make everyone know about these classes and to set up
Yes.
new classes. So if you want to, you can contact Joanne at the health department.
Definitely.
Best way to get a hold of you.
Well, my number is 920-232-3006, or just call the health department and they'll get in touch with me. I've got a email address, but if you call me, everyone's just a friend I haven't met yet. So, I would be more than willing to talk to you. It's just going to make the community of Winnebago County so much healthier.
Great. Again, go to our website, www.winnebagopublichealth.org, and you can click on the events calendar to see when these classes are coming up and be informed. You can just call us to sign up. So next we're going to transition into a video created along with some partners that we're working to promote the drug drop boxes in Winnebago County. Drug drop boxes are a safe way to dispose of your medication, and they're available 24/7. So check that out.
During the early 2000s, the mid-2000s, with the prescription drug epidemic that was occurring throughout the country, really, the drug drop boxes became one of the public services that the law enforcement community offered to rid on these prescription medications.
My name is Brian Scholtes. I'm a lieutenant with the Oshkosh Police Department.
My name is Brad Dunlap. I'm a special agent in charge with Wisconsin Department of Justice Division of Criminal Investigation.
It's my responsibility to make sure that the drugs that are put in this box are properly maintained until the date that we have a sort and they're turned over to be disposed of. Yeah, there's 4 locations. There's one here at the Oshkosh Police Department, Menasha Police Department, Fox Crossing, and Neenah Police Department.
All of the drop boxes in the area are completely anonymous and they're free. So there's no fees for dropping off the medications, nor are there any questions that are asked. They just ask that you follow the instructions on the box so you're not dropping sharps in the containers or other things that might hurt the people who are collecting or sorting the medications, but otherwise there's no questions asked. They can leave the medications in the original containers if they want. But it's actually more convenient for us at this stage for them to take all the medications out of the original containers as long as they're solids, place them in a plastic bag, a Ziploc bag, a paper bag, anything that's going to be able to go into the box size-wise, and that makes it easier. We used to actually sort controlled and non-controlled substances. We don't do that anymore. They're all combined into a single batch. So combining the medications is perfectly acceptable and it's actually preferred. If it's a liquid, just make sure the cap's on tight and that it's in its original container. And we're absolutely adamant that we don't get any sharps. We do most of our work with volunteers, and so we ask that people not dispose of sharps or any other dangerous materials inside the drug drop box. You can visit the health department website for Winnebago County and you will find areas that you can safely dispose of sharps.
We started the box here in Oshkosh in 2010. Since 2010, we've collected over 20,000 pounds or over 9 tons of drugs which have been properly disposed of.
Welcome back. That was a short clip put together to promote the drug drop boxes here in Winnebago County. I want to say thank you to our partners and officers, Brad and Brian. Just to reiterate, we do not want sharps dropped off at the drop boxes during this time. You can go to our website to find information about that. Our website is www.winnebagopublichealth.org and just type in sharps in the search engine and you'll be able to find a list of current places that will accept sharps. Usually you can buy a deposit box for about $5 to $8 and return your sharps repeatedly for that one-time fee. As always, thanks for tuning in to watch the Winnebago County Health Department, where we take public health and we relate it to you.